Good afternoon, everyone. I'm going to look to my panelists here just to get a comms check. Maureen, can you hear me?
I can.
Excellent. Good afternoon, everyone. Thanks for joining us. My name is Dave Callaway. I'm a professor of emergency medicine and the Global Health Security Officer for Advocate Health. Wanted to start out with a quick thank you to Camilla and Justin and the whole National Academy of Medicine staff for continuing to organize these great webinars that are both informative but also driving change across the healthcare system. So today we're going to have a conversation about mitigating the operational risk for healthcare sustainability leadership. We're going to begin with a roundtable discussion, and then we'll open up to audience questions. And our goal today is to further the understanding of how do you operationalize climate risk and planetary health risk into our mitigation strategies and healthcare operations. So I'm joined today by Kelly McKinney, Nathan Franklin, and Maureen Mazurek. This is an awesome group. They have a very diverse perspective, ranging from academic health systems to private health systems to a major vendor and supplier. So let's kick it off. I'm going to ask Kelly, Nathan, and Maureen to do a quick 1-minute intro of who you are, who you work for, and how you got here. So let's start with Kelly.
Thank you, David. It's great to be here with you and with Nathan and Maureen. I am an emergency manager. I'm a blue-collar working emergency manager here in New York City. I got into the business about 25 years ago. It's been a busy 25 years as an emergency manager in New York City. I can tell you that. But you know, and as busy as it gets, you keep looking for it to slow down, and it doesn't slow down. It only accelerates. So and that stays true even through yesterday and today. It is a very busy time to be an emergency manager in America. I can just say that. And I worked for New York City government for about 10 years at the New York City Office of Emergency Management. I was the chief disaster officer for the American Red Cross here in Greater New York. And then I've been here at NYU Langone Health, headquartered on East 34th Street and First Avenue in Manhattan for 9.5 years. And this is it's an amazing organization to try to live up to. And but yeah, happy to be here.
Awesome. Thanks, Kelly. And looking forward to hearing your perspective from Gotham. Nathan.
Thanks, David. Nathan Franklin. I'm the Vice President of External Affairs and Sustainability for Emplify Health. Many of you may know us formerly as Gunderson Health System. We merged with Bellin Health, also based in Wisconsin and the UP of Minnesota in the last couple of years, and recently have rebranded as Emplify Health with our continued commitment to sustainability. So my background is mainly in the political and public policy world. Worked for the governor of the state of Wisconsin for a couple of years, among other various political roles, and then transitioned to the public sector, where I worked for an electric utility for 10 years in government relations, and then also as part of some major utility scale projects teams, including several renewable direct renewable projects and renewable supporting projects. I switched over to Gunderson Health System in 2020. Was a natural fit for the public policy work, and then eventually was entrusted with the sustainability program that is one of the industry leaders. I think a lot of people are familiar with some of the energy independence that the organization has done, and we're continuing to evolve that through different ventures and projects.
Awesome. Thanks, Nathan. We're looking forward to hearing about the role of energy and resilience. And Maureen.
Thanks, Dave. It's great to be here. I want to thank the National Academy. I also want to thank my fellow panelists and you, Dave, as our facilitator. I'm Maureen Mazurek. I'm with Becton Dickinson, also known as BD. We are one of the world's largest device manufacturers. We supply about 37 billion devices worldwide annually. So likely we are part of your supply chain, and my fellow panelists, we are, and love being partnered with you. My my role, I have multi hats that I wear. So I'm the Chief Sustainability Officer. I'm also the Chief Environmental Health and Safety Officer, as well as physical security and product stewardship. And the way I try to explain my role is the through line across all of that is planet health or environment, because there's synergies across all of those. How I got here is I'm an operations person by background. So my degree is in manufacturing and supply chain. And I grew up in operations in the food and ag sector for many years, rose to various levels, including plant management, as well as corporate offices and strategy. And one of the original sustainability leads back in the early 2000s, I think I'm really dating myself, and made the shift over to healthcare a few years ago when I recognized the opportunity that BD had and the role that BD plays in the value chain of healthcare.
Great. Thanks, Maureen, for the intro and for all the work you're doing at BD. Let's get right to it. So people often joke about going to the hospital in July. I'm an academic physician, and so I've heard it every year for the last 25 years. All these fresh faces, these new doctors, right? Never go to a hospital in July. Let me offer a different perspective for this audience about July. So this July, on July 4th, the Guadalupe River rose 20 feet in under an hour, killing 108 people and causing over $200 million in damage. Reporting suggests that money may have been available for sensors and preventive measures, but it was reallocated or reinvested. And it's not a judgment. We always make decisions in the moment, but the money was reallocated rather than invested. July 14th to 15th, New York City, between 4 and 7 inches of rain pounded down on the city, flooded the subway, delayed 2,000 flights out of JFK and LaGuardia, and had a significant impact on mobility throughout the city. And then this week in my neighborhood in the South, I live in Charlotte, in our area around Georgia, North Carolina, and Florida, we're under this rare extreme heat warning, which apparently almost never happens. They get major heat warnings, but this is extreme risk to health. 11 million people and one dog. My dog was very unhappy this morning at 5 a.m. when it was 82 degrees out, and I went to take him for a walk. So heat, extreme weather, flooding, all have significant operational implications to how we deliver healthcare in our country. And so I'm going to start with you, Kelly. You're an operational leader in an academic medical center. You mentioned before and talked a lot about climate risks as a growing in frequency and severity. What's your framework for assessing threats and these risks? And then how do you convey it in a way that resonates with leadership that's rightly focused on patient care and financial stability, and in your case, training the future medical leaders?
Yeah, and you know, David, I'll go one. I'll raise your examples. I mean, you talked about heat. We are in the midst of a heat wave right now. Heat index in New York City is 105 or more. We have tomorrow afternoon, we've got unsettled conditions. As the heat wave moves away, we're going to have a low pressure system move in. A frontal wave is going to develop and stall. It's going to develop along a stalled boundary line with a deep tropical air mass. Is any of this sounding familiar? And several inches of moisture in the atmosphere, and which sets up those flash flooding conditions that we've seen. And so Wednesday into Thursday and Thursday afternoon, we're looking at a potential for 3, 4, 5, 6 inches of rain. It's another one of those flooding conditions that we've seen all across the nation. And then on top of that, we've got all this wildfire smoke that's pouring down from Canada. So day before yesterday, we had an AQI that exceeded 100. Right, we have PM 2.5 levels that are spiking in the atmosphere, and so it's this idea of cascading impacts and cascading risks. And so the question about frameworks, right? We overlay frameworks. We are the creators of order out of chaos, and so we have to have these orderly frameworks that we rely on in order to confront the chaos, and we have several of them. I mean, in order to assess the risks, we've got what in healthcare it's called an HVA, a hazard vulnerability analysis, and we leverage all kinds of stakeholder partners at a federal level, state level, There's lots of private sector open source information about risks, and we use that to supercharge our own analysis. Every year, we produce our own, what we call a key hazards list, which is really all the things that we are preparing for. And we meet with our stakeholders, and we ground truth that. And it allows us to focus, right? Because we live in what we call a threat-rich environment, right? It's New York City and the tri-state area. And I sort of belabored the fact that it was busy. At 6:30 yesterday afternoon, about 10 blocks from here, an individual walked into 345 Park Avenue with a high-powered rifle, right, and started to shoot. That was what we call a job. So we had that job. We worked that. We overlaid our orderly framework on top of that chaos in order to perceive what was happening in real time, surface all of the issues and obstacles and threats to our enterprise, right? We have the Tisch Center for Women's Health is 2 blocks from that building. We had another huge site that's a block or so away, and we needed to communicate with those folks. We opened a situation room. We had lots of stakeholders that we were communicating with in real time. And then we were also keeping our stakeholders informed, right? We were sending all staff messages to 59,000 people about what was happening and what the risks were, because it occurred at 6:30, which is a half hour before our 7 p.m. shift change, which is a big move for us. There's lots of our staff are in Midtown, either going to work or leaving work. So we maintain that situational awareness, and we work that job. So
Hey, Kelly, this is, so you highlight a very important point for this audience, because my background is an active shooter in this kind of event as well. And what we've seen is HVAs are always driven by what people remember as the most dramatic event. And so people will perceive someone shooting as a bigger threat for the health system. They should invest in this. How do you get them to actually pay attention to the real threat, which is the climate stuff that you just described? I mean, the CDC and the Public Health Department of New York just released a report in June that said flooding is the #1 public health threat to New York City. So how do you get your leaders to listen to that piece of it? Because oftentimes it's not quite as sexy and attention grabbing.
Yeah, and that is the issue. And you're absolutely right, David, that anchoring bias, right? You ask people what the biggest threat is, and it's going to be the last threat, the last hazard that they that sort of leaps to mind. And so, our job is not necessarily to focus our leadership on a risk to pull their attention away from delivering the exceptional patient care that we're known for. I mean, there was a big we just got an email this morning from our CEO about the rankings and how well this organization does. So we execute the mission, or my stakeholders execute the mission. I don't deliver patient care, but I've got the backs of those people that do. And so my job is really to understand what the range of risks are, and then essentially immerse them. We create awareness not by talking about ourselves, not by talking about what we do, but talking about what they do, especially in what we call gray sky. So we try to throw them in the deep end of the pool, if it were. And we use a lot of exercises with these detailed, rich scenarios to say, okay, put yourself in the moment, act as if, and then what comes to mind in terms of the things that we need to work on. We do a lot of that.
That's great, and I appreciate that. So the framing around the event and the extreme event is there. Moving left. So again, in our space, oftentimes we'll say left of bang, so left of the event before this. Nathan, modern healthcare requires a ton of energy to deliver on the goods, right? And I have to imagine in Wisconsin, both extreme heat and extreme cold, the unpredictability of damaging storms can create a threat to operational resilience, both financial. If prices are spiking, the operators always care about having a stable financial budget, but also physical. So can you describe your approach and how Emplify has made a case for energy efficiency and resilience, both from a cost standpoint, but also a continuity of care and a leadership standpoint?
Yeah, that's a great framing of that question, David. Upper Midwest, the weather volatility is high, right? We recently, within the last week, we had heat indices into the 109, 110 range, and it's not unusual for us to get wind chills down 30, 40 below zero. That's an intense swing, and puts a lot of pressure on our systems, but also ultimately on our utility bills. One of the benefits we have at Emplify Health, thanks to the foresight of folks like Dr. Thompson back when Gunderson first got into this, was we're in a relatively mature state at this point when it comes to our sustainability programs. So making the case is a little bit easier when things are pretty much paid for at this point. And most of the projects have the folks who are in our governance structure, they see the proof in the pudding from the last 10, 15 years. That being said, from the double green, as some of our champions over the years have put it, is an important part. Healthcare, a main theme I always hit, regardless of where I'm sitting and who I'm talking to, is healthcare. It's getting harder and harder for hospitals to make money in healthcare these days. Reimbursement rates from public payers continue to drop. We have reforming of programs like Medicaid, which is going to drive those reimbursements down further. And for a large rural health system like Emplify Health, we have a large number of Medicaid and Medicare patients. So that leaves us in the position of thinking about how do you make money in ways that don't involve healthcare, so that you can continue to serve your patients, serve your communities, serve your missions. And that's where the sustainability program resiliency really steps in. It's having the projects we have in place to save energy, to offset our energy use, and then to drive revenue in ways in the energy markets that help us support our healthcare mission. And that's really, for those who are just getting started in this journey or thinking about this journey, like anything, it's hard to imagine what things will look like in year 8, year 10, year 12, and beyond that. But it really is a matter of you can't get there if you don't get started. They had to build the Model T before they could build the Mustang GT. So you really do have to start that journey to start offsetting those costs and building your resiliency.
Yeah, thanks. It's a great perspective, because oftentimes the conversation around clean energy or renewable energy or energy efficiency goes something like this: first cost versus lifetime cost. Mm-hmm. Hey, if we had the capital to invest $30 million, yes, we understand there's a 7, 10, 12, pick your payback. And it's focused just on the payback piece of it. But what I hear you saying is maybe healthcare systems need an energy security strategy, which looks at just like the other organizations do, which says, hey, look, this investment not only saves us or makes us money, but it creates stability in operational expenses, which allow us to buffer against changing payer or declining payer rates in the future. So it's a business investment strategy and an operational strategy together.
Right, and I would characterize it another parallel I like to draw, David, is to IT security, right? Cybersecurity. We know, it's not if, but when in that space that you'll experience some sort of hack. Most hospitals are getting hit, hundreds or thousands of times a day with, somebody testing the fences. We invest in that because we recognize the risk analysis that's there. And it's not investing it isn't hoping that it'll happen. And I think the same thing has to happen in sustainability, right? We have to invest knowing energy costs don't go down, knowing climate risks are not going to go away or become less frequent, and knowing that the impact on our patients and our communities is not going down either.
That's a great framing, and certainly going to be one of my takeaways here. The parallel between climate risk to both our system operations and our communities and cyber. I mean, I think it's a great, because it is definitely not an if, but when. And I think if you go back to Kelly's point, I think one of the key takeaways is we need to drive data and cost quantification, which exists, but we need to put the rigor into it so that we can actually talk about this as a real risk. So those are great points. Appreciate it. Maureen, over to you. You give us all our stuff so that we can actually take care of patients. BD, major both producer and supplier. Certainly for our system at Advocate Health, BD is one of our major partners in supply chain. And they're huge, supply chain is a huge vulnerability for healthcare. We saw it in COVID. We saw it before COVID with, the disruptions in Puerto Rico and then Hurricane Helene. How is BD approaching climate-related operational risk to supply chain continuity? And how are you working with health systems to do this effectively? Because it certainly can't be done in a vacuum.
Thanks, Dave, and I'm really impressed by all of the comments by Kelly and Nathan. I couldn't agree more, and I took down some really great notes around energy security strategy, and I love this notion of a threat-rich environment. I'm gonna, Kelly, take that and use that, and I'll give you credit for it. But at BD, right, we understand what our role is, right? Our role is an enabler role. Our role is to enable health systems, our partners, to be successful. And while we've been doing sustainability related work for operationally for 10, 15 years, it really became crystallized for BD in September of 2027. And Dave mentioned it quickly, and I didn't even tell him I was going to use this example, but that was Hurricane Maria. And at BD, we have almost 80 different manufacturing and distribution centers around the world. About half of those are in North America, and 2 of those specifically are in Puerto Rico, and they were significantly impacted during Hurricane Maria. And so we did all of the humanitarian work to support our associates who were impacted, support the local community. But we also knew we had a responsibility to you, our customers, to ensure resilient supply. And so we had some things in place that helped us continue that continuity. We had safety stocks, we had components sitting in different locations, but those sites were down for nearly 30 days. And we knew it was essential to provide critical to health devices. And we were able to do that because we had some safety stocks in place. We relied on our suppliers, and we had set strong levels of safety stock there. But what we walked away from that with was a greater commitment in understanding the impacts of climate. And so for our strategy, we really look at 3 areas to ensure that continuity and resilience. First, our manufacturing and distribution networks. So we try to provide locally where possible and have redundancies in our system. So not one DC with all of one particular product, but spread out in case something is impacted. Secondly, we have redundancy in terms of manufacturing where possible. We do have a strategy around climate scenarios. And this was a little bit of a newer exercise for us because so much of the risk profile generally for businesses like BD is in a 5-year time horizon. And as we all know, climate is a much longer time horizon. So convincing the organization to lengthen that horizon and consider climate as part of the enterprise risk strategy was key. We did the same thing with critical suppliers. So that's the second lever is our own supply chain. We can manufacture, but if our suppliers can't get us the raw materials, then we run into problems. So we've put on a predictive analytics tool on the front end to help understand our supplier risk and help our suppliers mitigate those risks. And then finally, in terms of the supplier piece, we've gotten so good at operational excellence, building in sustainability into everything that we do operationally. We're taking that same level of knowledge and skill and helping our key suppliers build that out as well. And oftentimes we talk to our customers that that's something that is important. And if you need expertise in that, we can support. And then finally, I'll go back to what Dave said. We recognize no one entity can do this independently, that there are so many links in the chain and interconnectivities that we've stood up in 2021 a strategy called Together We Advance. And that's our 2030 plus sustainability commitments. Those are embedded into the way we run our business, embedded into the way we make our products, and embedded into the way that we approach our customers and our suppliers. So those are the ways that we're going about really taking a catalyzing moment back in 2027, reflecting on it, strengthening our system and our supply chain to better serve you, the health systems that rely on us every day.
That's awesome. Thanks, Maureen. I appreciate it. And also agree with this planetary health framing. So at Advocate, we have sort of we've repurposed our argument around sustainability and climate and all the different words into this planetary health framework, which looks at climate change, environmental pollution, and biodiversity loss, and both the impact that those have on human health, but also the impact that our healthcare delivery has on those three big buckets of work. And that's helped us, going back to Kelly's framing, to actually look at the threats, right? Because too often what we'd hear is people would shut off the conversation because they would say, plastic pollution in the rivers isn't a climate issue. You're talking about climate change. And so I think, one, framing it, two, being able to convey what you're talking about and why it matters, and three, to your point, what are the levers you can pull to impact change? So that's really great. Appreciate it. All right, Nathan, I'm going to come to you for a question. And for the audience, please feel free to populate questions in the Q&A. We're tracking all of that. And though we have a dedicated Q&A session at the end, this can be very dynamic. So if you have questions that are popping up, please put them in the Q&A and we'll get to them. So you talked a little bit about the energy work, and so that may be the answer to this question, but what's one specific policy or practice that Emplify has put in place that both reduces emissions or pollution, but also strengthens operational continuity for your rural health system?
Yeah, I think it's been the evolution. I was thinking a little bit about this, David, when you were talking about, how to advance this work for other organizations, especially if they're getting started. And, the first generation of our work in sustainability was offsite, larger scale, renewable projects. We have a couple of our own wind farms, which are kind of the backbone of that. But in recent years, we've evolved or moved towards net zero type siting as we move into new facilities, revamp old facilities. We have hundreds of sites. We have a dozen plus hospitals and 120 some odd clinic and care sites. And as we build new ones or remodel old ones, the goal is to move those towards being net zero facilities from a production standpoint, which obviously also translate to a carbon footprint as well. That is, I think a policy that is part of taking our program to the next level. The large scale utility obviously the large scale projects offset a lot of energy use, really help drive revenue and savings. And so it's a natural evolution of that to then go to having, we have so many clinics across the rural upper Midwest. And if we can make those sites self-contained, one, it protects future costs for energy use. It also supports those communities and puts on display, that we are working to save them patient dollars, as energy costs increase. But also it's using that first generation of the work that was done by the Gunderson Health System prior to the merger to build us into that next level of evolution for our sustainability. So to me, I think that's the policy at this point that's changing taking us to the next level.
Great, appreciate it. And Kelly, same question to you. What's an example of policy or practice that you as emergency manager are helping to ingrain into the whole disaster cycle, right? The mitigation and adaptation that happens prior to the event?
So we have, we were talking before about frameworks. We have, a couple of big concepts for us are blue sky and gray sky. Blue sky being a normal, everyday non-activation situation. Gray sky being in the midst of a crisis where you're activated. And so, one of our frameworks is a 5-step process: watch, size up, notify, activate, and operate. Watch, size up, notify, activate, and operate. So we're always watching 24/7. We're watching locally, we're watching regionally, we're watching nationally, and that allows us to be proactive in terms of those risks and threats that could potentially impact our ability to deliver patient care, research, and education. So an example is yesterday, and this isn't a climate job, but yesterday with that active shooter, right? We saw that immediately, and we were able to activate and push out some communication to all of our staff immediately about that threat. And so you can take that same model, and we talked about the flash flooding risk that's setting up for tomorrow and then Thursday. We meet as a team every day, every morning, and we huddle up and we do an extensive analysis of the potential for severe weather. And we don't take one forecast. We don't take the National Weather Service forecast. We have a number of services. We have lots of models that we use ourselves, and we piece together the reasonable worst case scenario, right? We're not interested in what people think is going to happen. We want to know what could happen. What is the worst case scenario? And that becomes our base case. That becomes what we think and act upon. And we say, and I wrote a piece that was in the Daily News this week about, we believe that had that happened in the Hill Country in Texas, for instance, that the outcomes might have been different, right? So our job is to be the professional warriors. We're the catastrophists. We're the ones that activate so that everybody else doesn't have to activate for these threats. So we don't believe people that tell us that everything's going to be okay. We're pessimists, and we do that on behalf of everybody else, so everybody else can go about their day and not have to worry about every risk and threat that could potentially befall them. That's something that we take on board.
I appreciate that. And, people used to call me a pessimist because I was in the same work, and I just said, I'm actually an angry optimist. But you set this up perfectly so pivoting from the catastrophe, right? So for some people and some systems, articulating the catastrophe is very effective. But as we look to long-term resilience strategies, moving this into the here and now and the regular business operations to build resilience, Maureen, I thought maybe I'd ask you a slightly different question, which is, what have you found to be either an underutilized or underappreciated tactic for integrating climate risk into your general risk mitigation strategy? And maybe you see it as either you have an example of something that's been very effective, or an example that you think health systems are not doing or suppliers are not doing now that they could do more effectively.
Dave, that's a great question. And I think there are a lot of things. If I had to pick one thing, I would say that, many of the things that I talked about a moment ago were about adaptation, recognizing climate is real. We have to address it. This isn't if, it's when, and preparing for it. So I think that's one piece of it. But the other piece of it is the mitigation piece. So how to think about how do we lessen the burden, lessen the impact? And that's something that over the past few years, we've gotten a lot of discipline around in terms of not only operationally how we manufacture, but how we're thinking about creating new products. And so we call that design for sustainability. So that's like that next level of thinking is how do we put less of a burden on an already unburdened planet? And how do we help our health systems have a lighter footprint? So I think that's the piece that is really getting, ahead of things, protecting for what's potentially going to happen? And then how do we try to bend the curve, if you will, if everybody does their part in terms of bringing down their footprint?
Yeah, I appreciate that. I'm going to pivot to one of our audience questions here because I love this question because it really invokes in me the angry optimist. So this is from Chip. So give me your best 30-second pitch that you would provide to a more skeptical C-suite or board that hasn't experienced a significant climate event and have responded to funding requests with a response such as X amount of money spent on this is X amount of money we can't spend on bedside patient care. I have heard this. I have several variations of the response depending upon to whom it's going, but would love to hear your perspective on that. And maybe I'm going to stall for 10 seconds while you think about it. And Kelly, why don't you start, and then we'll go to Nathan and then Maureen.
So we don't pitch, we show, right? So we find that risk and threat, and we try to model it as in an interesting way. We even create videos around it. We create we create a simulated operations briefs and news reports, and we throw our stakeholders into that situation. So, for instance, we have a major executive tabletop exercise every year, and last year it was a power outage that affected the entire Eastern Seaboard combined with a heat wave, right? And there are studies that show that there's one study that showed that if that happened in Phoenix, for instance, and there was a 3-day power outage combined with a heat wave, half of the population could present to the emergency departments, and 13,000 people could die. So we model that scenario. We model hurricane scenarios, flash flood scenarios, and then we also model the human cause scenarios as well. And out of those, often the C-suite will say, we need to invest in this or we need to invest in that. And so that's our.
Nathan.
Yeah, I always struggle with this a little bit. Like I mentioned at the top of the talk, in the upper Midwest, climate events have been a relatively everyday thing for ever, really, right? Like through the winter, we have a climate event pretty much every week, whether it's a blizzard or sub-zero temperatures. Summers are accentuated by heat risks and thunderstorms, tornadoes, all that sort of stuff. So I'll probably jump more to the funding side of it. And, it's not to sound like a broken record, but similar to what Kelly said, to show, I guess I'd probably pop a couple charts up. One showing public payer reimbursement going like this, one going costs incurred from private payers through pre-authorizations and things like that going like this. And then just painting that picture of what would you be willing to spend today to save $6, $7, $8 million a year, 10 years from now. And that's what our experience has been in this field. And imagine what you would do with those dollars today, and what looking back, looking ahead, watching the trajectory of things, what would you give to have those dollars 10 years from now? Because the reality is we know the cost of providing healthcare is going up, whether it's coming from climate risks or payer increased expenses or reimbursements going down to serve our patients and serve our communities and keep those facilities open. In rural spaces like ours, those things become a priority.
Yeah, appreciate it. Maureen, what would your argument be?
Well, I try to stay out of these 30-second pitches, right? That is like the worst possible situation you can get yourself into, right? What I try to do is work regularly with my senior executives who have to make those tough decisions, do a lot of education, do a lot of pre-selling, so that if I do have to make that 30-second pitch, I've already got the support. And the response I'm getting is, what else do you need? Not a yes or a no binary, right? But what else do you need? And so some of the ways that I do that are by meeting each senior executive with what's most important to that individual. You can tie anything back to climate risk, to sustainability, because all of this is interconnected, whether it's cost, whether it's revenue, whether it's patient care and better outcomes. There's always a way to tie it back to what they care about most. So, for example, one of the things that's super important to us at BD is what I call on-stream time, keeping all of our facilities, whether it's an R&D facility, whether it's manufacturing facility, whether it's a distribution center, keeping them up and running and putting out the products needed for you in healthcare. And so we've had some issues with the grid and brownouts or blackouts, right? And it's been a super big challenge, particularly in the summer months. And so the way I've positioned it is on-stream time and site hardening that gets me the investment I need in more green energy. It provides resiliency, it gets us to our net zero targets, and it is an insurance policy, right? So those are just some of the ways that I try to go about it. I try not to get into that 30-second conversation because I've already pre-sold in. I understand what those executives find important. I tie back to what we're trying to accomplish and to achieve those endpoints. And then one specific example of on-stream time.
That's great. And I find this often as a straw man, which is designed to try to shut down the conversation. And so we use a similar approach to all of you, which I think is wonderful. You've highlighted, you have to understand your stakeholders. So understand the influencers, understand what they care about, have a conversation, and then link, right? The whole climate resilience piece is so broad, you can always find a link to what they want to do, whether it's efficiency of action, time in the OR, whatever it is, there's always a link there, and not being dogmatic about which point you're working on. The other is, again, just for me as an ER doc, is this whole new language, right? And so Nathan, you talked about this idea of like NPV, like net present value, right? Like I have buddies who have MBAs, but like when you start talking about what is the value of a dollar invested now for the service and the value it provides 5-10 years down the road, getting to understand that language is important. And we try to link it to quality and value. We say, look, we can provide higher quality care, generating less waste at a better value because we're reducing waste from the system, and that generates operational efficiency. A day offline in one of our hospitals results in X amount of money lost, but also X number of lives impacted. And then I'm going to start using this cyber analogy of like, it's not if, but when. I think that's a great framing.
Yeah, and David, I want to call out, Maureen raised a good point about the grid and the impacts of the grid, right? Because so much of what we can do is a portion of it, right? But at the end of the day, we're part of the system, right? And no hospital will ever be completely off the grid. When you talk about risk mitigation, you can have a net zero, but systems fail, and we can displace energy, but we can't wholly produce our own. That is our reality right now, and the impacts on the grid. Another a reason to talk about this, right, from a resiliency standpoint, because artificial intelligence, data centers, and the pressure that's putting on the grid, pressure that's putting on utility scale energy to drive costs, and the vulnerability. The reality of the grid is it is very exposed. It is a massive piece of technology that runs across every corner of the country. And when you talk about climate risks, every time a hurricane blows through and wipes out power poles, what does that do for a community? What does that do for the long-term health of a community? I'm really glad Maureen raised that as an issue, because that is an under-discussed part of this conversation that needs to be a part of it.
Yeah, it's a great point.
And you know what, Dave, I was going to jump in and say, I tongue-in-cheek said I try not to get into those 30-second pitch conversations. And I truly think that's the case. But what if we could start educating potential future healthcare leaders on this topic. So it's never that binary, do I invest in this or that? Dave, with Advocate and BD together, we're looking at that landscape of what do future healthcare leaders need in terms of knowledge and capabilities around climate. I don't know if you wanted to mention anything around that.
Well, I mean, I think so. So two things. One, going Kelly or Nathan, to your point, I think that and why I started this out with it's a straw man argument is there is a ton of stuff that we do in healthcare that would fail the question of would you rather invest in this or patient care at the bedside? There's a ton of it, and so I think that one of the takeaway points here is the more data that we have on risk, and Kelly, this is in your space, so predicting risk both of catastrophic event, but also brownout and supply chain failures. What is the cost associated with that? Being able to have that data to make data-informed conversations, then you can start to say on the spectrum of investments, in order to be mission ready, we need to do these things. And this is where we think the climate investment comes in. Because I agree, climate investment may not be the number one priority, but it certainly needs to be handled with rigor and be part of decision-making for health system. And, I appreciate, Advocate being so large and BD being so large, but being in sort of different pieces of the health system, we need to come together and the conversations we're having about how do you partner to both strengthen supply chain, but also train future generations of biomedical engineers and clinicians and operators to start having this framework of thinking about climate risk as they develop new products, as they develop new processes, as we look at patient care. I mean, we as the end user can try to drive some degree of market signal, but we really need partners on the manufacturing, the supply and delivery side, to come together so we can do it effectively. All right, I'm gonna. There are a couple questions here I want to pop in. Oh, so many good ones. Let's see. Let's go with that. So Jane, this is I think a relatively straightforward question, but so question is what data streams or frameworks are needed for healthcare professionals or health systems to address climate threat multipliers? So is there a gap in the data is there a gap in the data that exists? Is there a gap in our ability to integrate climate risk data into our operations? Or are we just in a position where our systems haven't actually prioritized the data? This can go to any of you, but maybe Kelly, we'll kick off with you.
Well, I'm not a data expert. I'm not an AI expert. I can tell you that from my experience, there's definitely an early warning data gap in terms of our ability to model these threats and their outcomes. I mean, I've been a weather nerd now for 20 plus years. I mean, the business I'm in forces that, and our ability to forecast and what the models are can tell you, in my mind, is they're becoming less predictive rather than more predictive, and I think it has to do with the variables that are widening in the models themselves, and so we just don't have an ability to say with certainty what the 2025 Atlantic hurricane season is going to look like. I mean, there's lots of people that do it, and every other year they turn around and go back to the hurricane conference and talk about why their forecast was such a miss. So the long range forecasting is not a exact science these days. And but for me, we continue to just assume that the worst case is going to happen, and then we don't have to worry that much about it.
So Nathan and Maureen, I'm going to go to you. I'm going to reframe it a little bit. Beyond extreme events, data sets exist. Extreme heat, air quality, beyond the increasingly frequent severe events. I worked with one of our suppliers, and they showed me they have heat maps for every single census tracking and zip code where they operate, and the impact that they think that'll have on their ability to pay their electricity bills, but also for their vehicles to move and their products, like length of product survivability in warehouses, et cetera. as we build this into operations, is it we don't have the data, or health systems just aren't accessing the data effectively?
Yes.
Okay. Yeah.
I would say, I think Kelly hit a lot of this on the head. That the volatility that's happening in climate is going to make this really difficult. I share the person who asked the question's desire to want to know this information. I grew up on a farm in central Wisconsin, and the old adage was the best way to know what the weather is going to be today is what it was yesterday, and the best way to know what tomorrow's is what it is today. There's a lot of truth in that. It's one of those adages I think that holds up, but that's not a predictive model, right? Like that'll cover you for 3 days, but that's not going to tell you what next summer's going to look like and how much you want to budget for air conditioning, electricity use, and all that sort of thing. So, there's elements here, the predictive models of it. One of the risks I want to call out there, again, it's a little bit tangential, but we're losing weather service across the country, local weather service, cuts being made to national weather service. These are not directly to healthcare, but and it doesn't just impact our industry, but it impacts a lot of industries. And it's really hard, say you're a smaller healthcare system, say you're outside of in a more rural space. If your local weather station is now corporatized or become part of a conglomerate, understand business models and all that, but that makes it harder for you just to know what the weather is realistically going to be in the near term, let alone the long term. So these are all things that we have to figure out and navigate.
Fear not, Nathan. I know people have the power to control the weather. I'll reach out to them. Maureen, last word, and then we're gonna finish up on one final takeaway question.
Yeah, I'll be quick on this because I think Kelly and Nathan hit the nail on the head. There's a lot of data out there. There's a lot of volatility, right? That's the situation that we're in. I think I'm an eternal optimist, Dave, as you know. I am always the glass is half full, right? I think the opportunity is being better connected, right? Sharing information, working on the greatest risks together. So there's no reason why a health system and a device supplier, be it BD, be it somebody else, wouldn't share information and say, what are the 3 scenarios that we think are the greatest threat and how do we de-risk that? We do that kind of stuff on all kinds of other risks. In my opinion, climate fits perfectly into that type of model where you look at the scenarios, you say, what are the greatest likely risks? And then you de-risk them. And in this case, right, it impacts not only the device manufacturer, but the health system in sort of really profound ways because it has patient implications, not only with quality of device provided, but patient coming into ER as a result of one of these catastrophic scenarios, right? So I don't know why we aren't having bigger conversations about this topic collaboratively.
Yeah, it's wonderful, and I agree. It needs right. Like we need to approach this as much as we're purpose-driven organizations. I think continuing to address this from a business standpoint and innovation standpoint, a future model standpoint are important. So, all right, we're gonna to close it out. We're gonna just ask you if you could leave the attendees here with one key takeaway to take back to their leadership team tomorrow. What would it be? And Maureen, I'll start with you.
Oh, great. I have to have just one. I would say, and the word
it can be a lot of commas.
Yeah, with a lot of commas. I think the word is and. It's not or. They're not binary decisions. These are and decisions. The way I frame it with my senior leadership team, it's what we're talking about here is being a sustainable business. Don't talk about climate, don't talk about resiliency, don't talk about green energy. It's what is going to make us here for the next 50 years, right? This is certainly a key piece of that. And so that's my message is that it's an and. It's here to stay and has to be framed in a sustainable business framework.
Wonderful. Nathan.
I would say look for partnerships. That's been a huge part of the success of our sustainability programs. I'm loath to think of any of them that didn't involve a major partner. Both of our wind sites we have major partners on. A lot of our future projects, we have a biomass facility on our clinic. Those are partnerships with local family-owned forestry companies that support and are dependent upon us doing that. We couldn't exist without them. We're moving on what we think is one of the first contained microgrids on a healthcare site at our largest clinic in our system. That's a partnership with our utility. One of our wind farms also a partner with one of our utilities. Don't overlook the possibilities that are there. You don't have to carry this alone. There are experts out there, and major partnerships always help. We spun out part of our consulting in Eneration to help health systems do this. And that's based on the fact that people are looking for partners. They're looking for guidance. They're looking for assistance. Maureen's company does that. And then you have local partners who are also talking about doing this. Be in contact, have people whose role it is to build those relationships, because you don't know where they'll come from.
That's great. Partnerships are key. And Kelly, last word.
I would just say that if you're a leader in the past, you've your opinion of crises were that they're going to happen, but you've got a great team and you're just going to roll up your sleeves and you're going to get through it. And that was the opinion before COVID. And I think it wasn't true then, and it's not true now. I think a lot of leaders walking around sort of in denial now because of this. We're in this sort of poly-crisis age where it's just like all of everything's hitting at once, from the geopolitical to the climate risks to active shooters, and so they need the expertise that their crisis managers provide, and so they delegate. They have this massive machine that they have built. You think about supply chain, you think about the clinical side, and they have experts there that do that for them, but they don't leverage the expertise around crisis management, and they need to build that capability within their organizations, because these crises are going to come, and they're not ready. They delude themselves that they're just going to get through it when it's going to be nothing but pain and heartache. So they need to embrace the future, this poly-crisis world that we're in. But there are tools and there's expertise available, and they need to leverage that and partner with with an individual within their organization that can do that for them.
That's awesome. Well, thank you for the comments. So thanks to all the panelists for the great conversation, and thanks to the audience for sticking with us and spending time with us today. This remains an all hands on deck moment for healthcare. And what I took away from this group was, it's not if but when, it's not or but and. Look for partnerships, and then I'll just add my leadership is a contact sport and it requires action. So y'all are leaders. Titles don't matter. Actions matter for leadership, and so I appreciate everyone being here. The recording, slides, and resources for this session will be posted on the NAM webpage, and we have an upcoming series. Camilla, do you want to add any additional administrative information as we wrap this up?
Thanks, David.
Or Justin?
Everyone, please feel free to scan the QR code and provide any feedback you have for today's webinar. And thank you all for joining us again today.
Thank you, everyone. Have a great day.